All right. So today we have Juliet Sturkins. She is retired from private practice in Oshkosh, Wisconsin, has over 40 years of experience in the field of audiology, hearing aid technology, and communication counseling. She holds a degree in speech pathology and I'm not sure I'm going to say this right, Revalidate Academy in Haarlem in the Netherlands. She and Penny are both here with us today from HLAA's National Hearing Loop. If you want to tell us a little bit more about yourselves and HLAA and take over your presentation, that would be great.
So who's going to start? Penny, why
Okay.
don't you start?
Okay. I'm not going to speak much about HLAA because I know Juliet is. I'm honored to be here, but mostly I'm glad. I'm just excited to be able to share the experiences that I've had with being hard of hearing and just living. I grew up normally, went to college like some people do. I got married, had 4 kids, had a foster child. And yes, all those things change you. Getting married from being single, of course. Having children from having no children, of course. However, it's more the norm. There were people in the community that I could talk with. We could share the ups and downs of being a parent, of being married. Um, that was great. However, when I was 45, my oldest child, Greg, died at 22. He was in a work related accident. Of course, there's no words to explain it. Most people say, oh my God, I couldn't get out of bed, which is what I thought too. But I did. Yes, there was an obituary, there was a funeral. I mean, thousands of people come out of the woodwork when a child dies. Casseroles, cards, letters, flowers. With that, again, as I say, I went to psychotherapy because what I'm learning is that when you put words on it, words are so healing. I said things to her that I never would have known I thought. Then at 50, I lost my hearing, a big chunk of it. I was in an accident on a vacation, and then I noticed, and I had a closed head injury, and I noticed in that following months that I was really struggling with hearing. So I went to an audiologist thinking, maybe I just have wax in my ears. That's a big thing. A couple of my friends thought they were hard of hearing, and they found a lot of wax. I wasn't that lucky. And the audiologist said, yep, you got significant hearing loss. Well, let me show you about the hearing aids. And he gave me a tutorial. Meanwhile, I am hardly breathing. I was 51 years old, and I'm thinking, come on, I'm too young. My parents lost their hearing in their 80s. I can't describe that. I remember going home, throwing myself on my bed and sobbing. It's like it felt like my life was over. Now I'm old. Like now I think as if that's bad, but um, when my son died, as I say, people came out of the woodwork. They just were all putting themselves in my shoes. So yes, and a lot of them wouldn't say anything. And I learned later they didn't know what to say. With hard of hearing, you hide. And those of you who work in senior centers, I think you can see that. Either they deny it. Many of those people are hard of hearing. Either they don't have hearing aids, or if they do, they throw them in a drawer because they're too hard to motivate to get working. I guess with him saying that to me, yep, you're hard of hearing, it reminded me of someone having cancer and the doctor coming in the room and saying, yep, you got cancer, so we'll start chemotherapy right away. I mean, come on. It just absolutely no humanity. So the shock was, it can't be me. It can't be me. I am a competent professional. I worked in psychotherapy with teens and adults for 40 years now. I loved fun. I loved parties. I loved being social. That was my whole being a mom, being a wife. It was just being normal. Um, and I think I must have thought that's all gone. That's what am I going to do? So really, basically, I lost a lot of self-esteem, confidence. I wouldn't talk in a group because I knew I couldn't hear what they were going to answer to me anyway. Um, I guess what I'd say, and it makes me feel teary, it's like being alone in a crowd. It's like everyone's enjoying themselves, and I'm just standing there wanting to suck my thumb. Um, in retrospect, that was the worst. I went into woe is me, I'm a victim. And I think there are two ways that people react, either passive, which I think we start out like that. Good God, not me, anybody else. And the one they'd say, I have a disability. Are you serious? I was always competent, knew what I was doing. It's funny, I would be hurt that people, when I would tell them that they didn't notice, but then if they did notice, I didn't want them to notice either because I felt like such a weirdo. Eventually, I began to tell friends and family. Let me give examples. I have 3 adult kids and 8 grandkids, and they all live nearby, which is great. It would even be greater if I could hear what they were saying, especially the little ones with these little voices. Let me give you a couple examples. A cute one is that my oldest grandson at the time, he was 6, now he's 21. He said, Grandma, I don't know why you can't hear. You've got your earrings on. So is that just the cutest damn thing? Isn't that? Well, his sister, Shannon, who was 4, she was sitting at their table and she was drawing something, and I was babysitting and I was at the kitchen sink. And I ask her a question as if I'm going to hear her across the room. But she answers, and of course I don't hear her. So I say, Shannon, could you say that again? I didn't hear you. And then she says it again, and I can't hear. And I don't want to say it again. So I walk over toward her and I say, can you just say that again? She says, I said, which is what I hear husbands and wives do all the time. I'm sick of it. Come on. That was my first lesson in how hard it is to be a person who is in the same room or a relationship with a hard of hearing person. It's miserable. There was a couple things. I went to my sister's funeral and could not hear one word in the eulogy said about her. I went to my brother's funeral 2 years after and heard nothing. That almost felt like a bad joke. I was the closest to them, and everybody else can hear it. It's like, but too bad, Penny, you can't hear it. When my friends did know, 4 of us went out to dinner. I made sure we went early in the back of the restaurant. And it worked out fine at first because I was talking to the gal next to me and I could read her lips. But the minute that the 3 of them started talking one over the other, forget it. So I sat there and I sat there and I tried to eat, but I was feeling nauseous. Eventually, I just got up, went to the bathroom, sat on the toilet, and cried and cried and cried, thinking, what is my life turning into? It's funny, that was so long ago, and yet I get tears thinking about it. Probably what turned the corner, but was horrible. My kids and I own a cottage in northern Michigan. And on the holidays in the summer, we are all there. So that's a lot of people. The funnest part is that at 5 o'clock, after boating, swimming, and all that stuff, everybody gets around the kitchen counter with wine, beer, cheese, crackers. It is so much fun. I should say it used to be so much fun. Little by little, I'm going to ask Julia to somehow get this on your program. There's the name Sam Triken, who is an aging psychologist, an expert in hard of hearing and how to talk to people. He wrote a series of workbooks, which I bought immediately. And one of them assignment was find somebody in your family that you struggle with particularly. in hearing. So I asked my son, Tommy, and he said, sure, but Mom, I tell you, I've always known you were hard of hearing. And I looked at him like, how did you know? He said, Mom, we're all standing around talking and laughing, and I look at you. It's like you're numb. Nothing's going in, nothing's coming out. He said, I just didn't know what to say. Truthfully, I was touched that he did get it. So I started using the workbooks. I would recommend that immensely.
Can I jump in here, Penny?
Sure.
I think you're really expressing what a turmoil it is to lose your hearing.
Mm-hmm.
And it's not the same for everyone, but you're describing it in such incredible terms. I'm sitting here going, I wish somebody would have come to my audiology program and talked like you did to me. So I'm also mindful of the time this morning. So
Yes.
I have a lot of slides prepared for those who are in attendance, and I'm going to zoom over a lot of these, but Penny and I want to provide resources for those of you who are here, because obviously you're interested. You want to ensure that the services you provide are easily heard by your members or your people in the community. And you also want to support people with hearing loss. So I'm going to start my slides. If I remember how to do this now. Oh yeah, here it goes. Did I do the wrong thing?
You did your whole screen, which is fine too. Before, when we practiced, you did just your window.
A window. Okay, got it. Sorry about that. Shows you that I'm more familiar with. Here we go. So my background is really audiology. I'm trained as a speech language pathologist in the Netherlands. That was over 40 years ago. I moved to the United States, studied audiology, and the main reason was that I discovered during my studies in the Netherlands that my father was very hard of hearing, and I wanted to help him, but at that time I was unable to. So I moved to the States, and back in 1988, I purchased a private practice in audiology, which allowed me to practice and be the audiologist that I really wanted to be. So here we go. Hopefully you will get a lot of information. I'm happy to share slides. I understand these presentations will be put on the web so you can reference, but by all means, reach out to Penny and myself if you have questions. So here's my outline, and it's a pretty ambitious program for this morning. We're going to talk a little bit about hearing loss and healthy aging, what's happened because of COVID, a little bit about hearing assessment options, treatment options, and then the ADA, the Americans with Disabilities Act, and how it relates to hearing loss. And there's that word disability that Penny just mentioned, because people with hearing loss don't consider themselves disabled. And then I'm going to get to the meat for you as professionals, talking about how you can optimize hearing access in senior centers and other public venues, and what you can do in the form of programs for people with hearing loss in your community. And by the way, just to go back, people with hearing loss don't want to be called the hard of hearing or hard of hearing. Really, the correct terminology nowadays is a person who has hearing loss or a person with hearing loss. Prevalence of hearing loss is tremendous, and that is because it's heavily skewed to aging. As we age, our hearing loss increases, and for most of us, it's not a matter of If you're going to lose your hearing, it's going to be a matter of when you're going to lose your hearing. And in that aspect, you need to look at your parents. If your parents had trouble hearing, there's a pretty good chance you're going to have issues as well. So my advice there is choose your parents very wisely. About 1 out of 3 people over the age of 60 has hearing loss, and that increases to well over 1 out of every 2 when we reach our late 70s, early 80s. And you know, nowadays 80 isn't old anymore. So let's look a little bit at the audiogram. An audiogram is a graph that shows how well a person is capable of hearing. The blue bar is normal range, X's are left ear, circles are right ear, and pitches occur at the top of the graph from left to right, from low to high pitch, from very, very soft to very, very loud. And if you have normal hearing, then all the speech sounds, the critical sounds, all the vowels and all the consonants are easily audible. But with our age, I mentioned that earlier, our hearing changes. And these are graphs of normal aging women and men with no any kind of ear pathology. And at age 15, again, you can see that their hearing is right at 0 decibels in the normal range. Even women age 25, normal hearing. But then look what happens. By the time we reach the age of 65, we are all starting to lose the hearing sensitivity in the higher tones. And note that men are at greater risk than women. Why is that important? It's important because speech is understood by hearing the consonant sounds. The consonant sounds carry about 80% of the speech intelligibility. So if I give you this sentence, none of you are going to have any trouble hearing this. I live in Wisconsin, hence this example, but it's the Packers didn't play in the Super Bowl. But that's not how 80% of people with hearing loss hear. They have trouble hearing the consonants and have no trouble hearing the vowels. So they can hear emotion, they can hear anger, they can, if you know your partner, you can hear in the tone of their voice something has happened, right? But when you have only the ability to hear vowels, you will hear something like this. I'll give you lots of time. Trust me, you're probably not going to figure it out unless you know that I'm Dutch and that I really like tulips. So you can imagine a person with hearing loss is constantly doing the stretch of the ear trying to discriminate speech. So here is a typical audiogram. It could be a Wisconsin farmer. It could be a veteran who's been exposed to a lot of noise. It could be a 40-year-old who did some work in a rock band. But you're seeing that this person has good low-pitch hearing, has a significant amount of high-pitch hearing loss. And yes, this person is able to hear the vowels, but he or she has trouble hearing consonants. And the typical complaint from this kind of person is, I can hear, but I cannot understand. Couple that with somebody who speaks very rapidly or has a heavy accent or a dialect, and now it's a double or a triple whammy for a person with hearing loss. So here's a much better analogy when we talk about hearing loss. If perfect hearing looks like this, hearing impaired hearing looks like this. Now, if you give this a moment, you can figure this out. But it takes time. And people with hearing loss don't have that time, but because communication moves on, continues on. And then, of course, you get things happening like this. I think you need a hearing test. The typical spouse of somebody who lives with a person who's losing their hearing. And this is the answer. Why in the heck do I need a hairy chest? And I have clients, and I'm sure Penny can tell you similar stories of misunderstandings. Now, I've mentioned aging. I've mentioned noise exposure. But there's lots of other causes of hearing loss, and I'm going to skip over these. But it could be earwax, it could be ear infection, it could be injuries, it could be small strokes, it could be infections. But the biggest one in this whole list is getting older. 1 out of every 3 persons with hearing loss has hearing loss because of their age. There's other health conditions that affect hearing in adults: diabetes, heart disease, strokes, brain injuries. Of course, these are all diseases that cause either narrowing of the arteries, poor blood circulation, and that's going to affect the small blood vessels in the inner ear. It could be ototoxic medications, could be hereditary factors I mentioned earlier. What does it do to people with hearing loss? And I am just giving you a couple of examples. It affects their psychosocial functioning. Hearing loss is linked to an increased risk of depression and loneliness. And I think Peggy explained this very clearly. She felt like the outsider. She didn't feel like going anywhere because she had trouble hearing. But it also is linked to an increase in risk of falls. People who don't hear well are at greater risk for falling. They're also associated with their driving ability. Well, duh, small surprise here. My uncle had 5 accidents. He could not hear, didn't hear traffic around him, totally oblivious, was almost deaf in one ear, refused to wear his hearing aid, but no doctor said, "Sir, you ought to be using your hearing aid when you're driving in the car." So these are all issues that are exacerbated by having hearing loss. And of course, the most important reason, or the one that we're hearing a lot about right now, is that there is a relation or a positive link between hearing loss and dementia. So the greater the hearing loss, the higher the likelihood of a person developing dementia. So here is a person, or here's the hearing loss, and here is the cognitive and physical functioning. Now, if the common aging process that causes hearing loss is also the cause for poorer cognitive and physical functioning, then wearing a hearing aid is not going to make any difference. Wearing a hearing aid is not going to improve your cognitive and physical functioning. But according to Dr. Frank Lin, and his video can be seen on YouTube if you're interested in that link, he is surmising that having hearing loss causes the person to be subject to a greater cognitive load. They have to pay more attention to the ordinary part of hearing, and therefore it's going to affect their cognitive functioning or physical functioning. It's also been shown that not hearing well in a certain frequency range causes that part of the brain to no longer respond to sound. And I've certainly seen that in children that were originally fit with only one hearing aid, even though they had the same hearing loss in each ear. The ear that had not worn the hearing aid by the age they were 20 was incapable of understanding speech. And we also, Dr. Franklin also surmises that being socially isolated will affect your cognitive functioning and your physical functioning. But really, the bottom line is that hearing loss has the ability to speed up cognitive decline. But there's some good news. Good news from a large study in France, and this is a 25-year-old study where she demonstrated, Dr. Amieva, that with people over the age of 65 who opted to treat their hearing loss, they experienced the same rate of decline of their peers without hearing loss. So in other words, wearing hearing aids is good for your brain. And then a fairly recent study from the UK again proved further evidence that there is this association between hearing loss and dementia. And he indicated that hearing loss is a potentially modifiable risk factor for dementia. In other words, if you treat the hearing loss, you may be able to stave off or at least delay the onset of dementia. And Dr. Lin at Johns Hopkins is in full swing studying this with a large study, again, probing the relation between hearing loss, cognitive decline, and the effects of using hearing aids. And it's anticipated that that study will take a couple more years. Now, COVID, throw COVID in this mix, right? And remember, people with hearing loss, again, this is age versus prevalence of hearing loss. This is the rate of hearing aid use in these different groups. So you can see that average hearing aid use is somewhere on the order of about 20-25% in people with hearing loss, and in younger age groups, that's even less. And that could be because when you're younger, you can think quicker on your feet. You can fill in the gaps a little bit easier than when you're older. But the big issue with people with hearing loss and COVID is that masks really block visual clues or cues. And that's also been the reason why audiologists have suddenly been inundated with people coming into their office to get their hearing tested. Did they suddenly have hearing loss? No, but they had hearing loss all along, but the masks prevented them from lip reading. Masks, of course, reduce voice level. And for those of you who are not aware, there are clear masks available for sale that permit some visual clues, but they're not a panacea because clear masks tend to block some of the speech frequencies a little bit more. So you get lip reading back, but it affects the sound a little bit more. And then, of course, COVID means that there's a lot more communication going on between plexiglass barriers, and that reduces the speech intensity even further. And then we're all on Zoom, we're all on Google Meet. And I don't know about you, but I've been in meetings where people think that having a microphone on top of the computer results in excellent sound. Sometimes they put the microphone too far away from their mouth. There can be backlighting, there can be lack of captioning, and I think that captioning should be a must for any public meeting. So Peggy kind of discussed the typical hearing loss symptoms, or some of them already, but it's very much misunderstanding conversations and questions, inconsistent responses, because they may be able to hear one thing but not something else. So then, like, what's going on? Why isn't mom or dad responding properly? Asking people to repeat frequently. My father did a lot of the cupping of the hand behind his ear to hear. Oh my God, the radio in the car was so loud you could hear him coming down the block. But you know, the first thing my father would do is put the car into park, and his hand would go to the radio to shut the radio off, and then he would open the door so we could get in the car, because he knew we would complain about it. People withdraw from conversations, and kind of inconsistent issues in poor acoustic environments. And we're going to talk about why that is. There's some great, terrific resources available from HLAA, the Hearing Loss Association of America. And I get grant funding that is routed through the HLAA organization to give this lecture. So let's talk a little bit about assessment of hearing, and I'm going to give you 4 different ways, actually, that you can use to assess hearing if you're attending because you have a parent or a family member. I'm going to give you some tools that you can work with. So first one, smartphone apps, and they are available from all different sources, including Unitron, which is a hearing aid company. But I like the Unitron app because it doesn't only test your hearing, it tests the ability of a person to hear in background of noise. Then there's validated questionnaires available. One of them is the Hearing Handicap Inventory by Ventry and Weinstein. It goes back a long time, has been used in many, many studies. 10 easy questions, 5 probe the emotional aspect, and 5 probe the social aspect of a person's communication issues. And one that I favor, one that I really like. It's hard to find, but I'm happy to share it with you. It's the Better Hearing Institute Quick Hearing Check, which was validated in a big study. I was actually part of the group that gathered data. Then some really easy probing questions that ought to be in everybody's toolbox. Straight, being Dutch, I do this kind of thing. I look somebody in the face and say, do you have any trouble hearing? And then they go, why do you ask? And I say, well, I'm an audiologist and I have observed this, or this. Like Penny's son had observed his mom not laughing at the jokes, not responding, not hearing in groups, right? Another good question to ask is, so how easy is it for you to hear in background of noise? Or do family members say you're not hearing like you used to? And then usually the wife or the husband sits right next to them going, oh my God, the roll of the eye is a sign right there. And then the fourth gold standard test is an audiological evaluation in a sound-treated room, hopefully by a very empathetic audiologist who will give you time during the discussion of your test results to really mourn the fact that you have lost hearing and to kind of process that information. This type of evaluation ought to include tone testing, where you're asked to push on a button when you hear a beep, and the audiologist will vary the intensity and compare that to normal hearing young adults. But it should also include a test that measures the tolerance of loud sounds, and that's because a lot of people who lose their hearing have trouble tolerating loud sounds. They can't hear the soft sounds, but oh my God, if it's too loud, they will jump out of their chair. And that tolerance problem is called recruitment and requires very, very careful evaluation and also very careful adjustment of hearing aids. Tests should include speech in noise testing, meaning how well is a person capable of understanding speech in the presence of background noise. And there's big differences between people, how they are able to process in background of noise. And there should be an inventory, a checklist that probes the different situations a person has trouble hearing in. If your audiologist only gives you a hearing test, my advice is to look for a different provider. Now, I'm going to jump into the hearing loss treatment options. And the first ones I'm going to show you are literally options that you already may have in your smartphone. So there's apps available, and here's a whole slew of them: Jacody, Petrolex, Ear Booster. These are devices, or these are apps that test your hearing and then make a modification in the amplification to accommodate for example, more high-pitch hearing loss. But that's a phone app, but you can also have an analog handheld amplifier. The most famous one is probably the Pocket Talker. So if you deal with adults and you want to have a good conversation, this type of device would allow you to make conversation while you're holding the microphone. Here you can see the speech therapist holding the microphone close to her mouth. This woman could sit clear across the room and she'd still hear that speech therapist as if she was 8 inches from the mouth of the speaker. And you can clearly see the response of the woman to this amplification. Some hospitals have started to hand out these super ear devices. They're cheap amplifiers, but in quiet, and if you don't handle these devices too much because they cause microphone noise, they can do the job, and frequently they are then given to the patient once they discharge the hospital. Then there's captioning apps. That would be a whole other lecture, but Ava is a well-known one. We talked about Google Live Transcribe. If you use an Android phone, it is a must app on your phone. It will put captions on your telephone just as well as the captions that are appearing on the bottom of your screen right now. Then currently, and these have been around for a while, you're hearing a lot about over-the-counter hearing aids. Over-the-counter hearing aids have been around for a long time, but the FDA is expected to put new rules in effect for over-the-counter hearing aids, because in the past, over-the-counter devices have not been allowed to call themselves hearing aids. Here's the problem, as I see it at this time. A lot of consumers are on their own. They're not techy enough. And I can tell you, my 95-year-old mother would not be able to handle most of these devices, even though she's been wearing hearing aids for 15 years and she has no trouble wearing them. But she started younger, right? There's no professional programming, again, no verification and no proven track record yet. But that we're going to be seeing some big changes in this area is for sure. Bose has just introduced their first set of devices, and some have been around for a couple of years. They will work for milder hearing loss. And then the final option are hearing aids. And truly, it is not the hearing aid. If there's one thing you take away from this lecture, is that it is not the hearing aid that makes how well a person is going to function with hearing loss. It's the provider. And preferably, it's a provider who follows best practices. And I recommend you Google best practices and Cliff Olson. Dr. Cliff Olson puts all kinds of videos on YouTube about hearing loss, and this is probably his most viewed recording. And anyone who's fit with a hearing aid ought to have objective real ear testing. And if anyone has any questions, any of you are watching this video and wear hearing aids and you don't know what this is about, feel free to email me. Some device, or most of the devices, I think it's right now over 70 or 75% of the devices are worn over the ear, but still the in-the-ear models are available, and some can be worn for a couple months at a time, very deep in the ear canal. They're called Lyric. A lot of hearing aids are now directly connected to smartwatches and smartphones and are rechargeable, but there's a lot of features that you have to wade through as a consumer, and it behooves you to do your homework. So I'm going to try and help you with that. Last option for those whose hearing aids are no longer providing good audibility, there's cochlear implants. And cochlear implants have come a long way since I had one of my patients go to the Mayo Clinic in the early 80s to have one. She was operated for a cochlear implant. The whole issue at that time was that they did a lot of experimentation on people who were deaf. And if you're deaf and an adult and you get a cochlear implant, you do not have that part of the brain, actually it's on this side of the brain, developed to benefit from hearing the sounds that the cochlear implant is stimulating the brain with. So we are finding, and that's why the age limit for cochlear implants has gone down and down and down, whereas we are now implanting kids as young as 6 months old, because that's the key time to start stimulating the auditory cortex with sound so that they do develop speech and language. Couple of important hearing aid features that you will probably hear ad nauseum about from your provider: how the hearing aid has noise suppression, how the hearing aids have directional microphones. But here's the big but: evidence is lacking that it improves speech understanding in noise. They will make hearing more comfortable, less noisy, more tolerable for people with hearing loss, but only under very specific situations will these two features make a dramatic difference. They make small differences. Then there's rechargeability options. That's good for people with dexterity issues, although I personally still advise to getting hearing aids that are rechargeable, because these batteries do not have eternal life, and that means the hearing aids have to go back to have new batteries installed. Volume control, fortunately, with a smart app or a phone app, you can adjust volume with the smartphone very easily, but a lot of experienced hearing aid users want and still demand volume controls on their devices. And then a fifth feature, frequently a low-cost or no-cost option, is a telecoil. And the telecoil is critical for either listening on the phone, for listening in hearing loops, and using other ADA systems that are mandated under the ADA, the Americans with Disabilities Act, to make those places more accessible. We're going to talk about that some more. This telecoil feature, by the way, comes recommended by Consumer Reports and AARP, and recently in a great article by Forbes Health and Hearing Aids. If you Google that, you'll find some awesome information there by audiologists who are very rehab minded. Some other features, the features that are being touted by the hearing industry: Bluetooth connectivity. I tell you, my mom can't handle it, but for those who can and who are on their phone constantly, it can be a lifesaver, because you can answer the phone hands-free while in the car, or while you're literally walking around town. I think another feature that I see not many people use, but I think it's one of the most terrific options, are TV streamers. This little box on the TV will wirelessly broadcast the sound into the hearing aids as if you're right on top of the TV, and thus, of course, improve understanding. The people who have it rave about it. I just don't see enough demonstrations by providers. And then there's remote microphones, same kind of feature. This microphone will wirelessly transmit the sound from her mouth direct into her mom's hearing aids and make communication easier. And then kind of a caveat that the type and the model and the style of hearing aid is truly dictated by degree of hearing loss, by the user's needs, by his anatomy, by the shape and the curve of the ear canal, whether they have earwax, whether they can handle devices, and of course the net cost outlay. And that would be a whole other lecture, frankly. But let's just kind of talk a little bit about benefits and limitations of hearing devices. What I mentioned earlier, the takeaways from one thing you need to take away from this lecture is that hearing aids don't restore hearing like eyeglasses restore vision. They are useful in quieter situations. They have a very limited range for most users. That's under 6 to 10 feet, but for a lot of people with more significant hearing loss, that hearing range is less than 3 to 5 feet. And I have friends who need to be 2 feet away from me in order to hear me. And you can tell how loud and how clear I try to speak to make sure that everybody hears. In noisy, and there's the reason why, in noisier and large rooms and in public places, hearing aids pick up all the sound. And I'm just going to do the demonstration. You're sitting in church, somebody starts crackling with the church bulletin. Guess what the person with hearing aids is going to hear? They're going to hear the crackling, the shuffling of the feet, the children whining in the background. Because hearing aids pick up all sounds. They don't know what sounds you do and don't want to hear, and that is limiting the benefit to the user. So in public places where speech is difficult to hear, and that's usually because of reverberation and distance and background noise, even if a microphone is used, the ADA, the Americans with Disabilities Act, mandates that an assistive listening technology is used. In fact, if you are managing a senior center with a PA system, by law, you are required to provide assistive listening technology, and that can come in a variety of styles. If you have a question about that, again, please email me. But just to show you why this is happening, the teacher's voice in the front may be easily 15 decibels over the background of the typical room, but in the back of the classroom, her voice will mix with that level of background noise, causing a negative signal to noise ratio, and this person is going to have trouble attending, is going to have trouble hearing. And if this person has hearing loss, forget it. That child is going to be off the air. It's the reason why we recommend special equipment for children in schools, even if they wear hearing aids. Now, these assistive listening systems, think of them as wheelchair ramps for hearing aid users. Okay? Wheelchairs are great, but if there is a stoop that's 20 inches high, the person with the wheelchair cannot get into your building, and your facility would go, oh my God, what did the contractor do? Why didn't they put in a wheelchair ramp? My question to you is, if you offer a PA system, why are you not aware that there is an assistive listening system? And better yet, make yourself aware how to work it, how it works, have handouts available, and make it a point to announce it at every meeting. So the ALS, the assistive listening systems, are required, and this is the exact language from the law, where audible communication is integral to the use of the space and an audio amplifier is provided, an assistive listening system shall be installed. And by the way, there are 3 different systems: FM, infrared, and hearing loops, and 9 out of 10 consumers with hearing loss opt for the hearing loop technology as being the best and the easiest type of technology to use. And just a little note here, out of every 100 people with significant hearing loss, only 3 use a sign language. The other 97% need access to very clear speech. Now, a hearing loop is an array of wires installed under carpeting or flooring, and when an audio signal from a microphone is routed through this wire, amplified in electrical current, it creates minute changes in the magnetic field that the telecoil inside the hearing aid can wirelessly pick up. So this person can walk into this library room, sit down. When the person starts to speak, they activate their telecoil, and the sound from the microphone will appear direct in their hearing aid, and better yet, without background noise. So it's a small wonder that people with hearing loss rave about hearing loops. I recommend you Google hearing loops. There's some videos online. Will make it very clear to anybody. There are a number of different hearing loops. There's room loops. Some loops only have one wire around the room. Some have an array of wires. Offices that are now behind glass are installing speech transfer systems with hearing loops. So you can be behind the counter and hear from the microphone that's installed on her side as well. And there are offices that are now using these types of portable hearing loops. How do you know if there's a hearing loop installed in a facility? That's when there is signage with the letter T. The slash of the ear means they offer assistive technology, but if there's a T, or if it says loop facility or hearing loop, it means that they have a hearing loop installed in the facility. If the signage lacks the T, it means that the person with hearing loss needs to go to the front desk, pick up a listening device, pray it was charged and well maintained, sit down in their space and use that device. By law, they're required to be provided with neck loops, but my experience is that that doesn't always happen. Who can use hearing loops? Well, first of all, everybody who wears a hearing aid or a cochlear implant that has a built-in telecoil. People who don't wear hearing aids can wear a headset that looks like a little pack of cigarettes with earphones that can tie into the loop signal from the hearing loop. You can now buy some over-the-counter devices that have telecoils. And if you have a smartphone, only for iPhones though, you can buy a set of earphones called Loop Buds. Telecoils and hearing loops have been in the media big time, the hearing loss or the hearing industry media, because hearing loops have seen a major revival in the last 12, 13 years in this country. If you travel and you go to Australia or to the UK or to the Nordic countries, you will find hearing loops in most houses of worship, post offices in the UK, auditoriums. The Opera House in Sydney has hearing loops installed. But there's a huge push in this country to foster more hearing loops. There's hearing loops initiatives around the country. I'm not going to belabor this, but these are almost all consumer-led HLAA members who are pushing for hearing loops in their states. And so what I want you to take away from this part is that hearing aids work. Hearing aids work for the range that they are intended, 2, 3, 4 feet in quieter situations, but that for the situations where hearing aids and implants do not work so well, there are workarounds. It could be a remote microphone, it could be a TV transmitter, and for public venues, it means using assistive technology. So I'm getting to the final 2 slides of my presentations. And the first one is for you as a aging care provider, as a social worker, as somebody who is managing a senior center. I highly, highly recommend that you have an in-service on clear speech, on communication strategies, how to work and deal with people who have trouble hearing. And clear speech, there's great handouts available if you're interested. Here's the answer. Email me. I'll be happy to send it to you. Always activate captions on TV or movies that you're playing in your facility. I don't care that somebody don't like captions. Don't look at them. But captions will make it possible for people, particularly those who speak English as a second language, to get that extra bit of information that allows them to process information. And if you have kids, it teaches kids to read better. So here's another great hint. Consider a speech transfer system at your front desk. That's a system that picks up the voice from the person behind the glass and will slightly amplify it. It can make a huge difference. They are in use all over Europe. and that's because a lot of business was already done behind glass in those countries. In a meeting room where you have a PA system in use, become familiar with the ADA law and install an effective assistive listening system. I'm happy to help you with this. Be sure to include signage. How else are people going to know that you have a loop installed? For example, here's a nice big sign, and underneath are flyers that explain what a loop is all about. For one-on-one meetings with people who are very hard of hearing, consider using a captioning app, become familiar with it. And last but not least, and this is a pet peeve of mine, I'm sure you recognize my personality. I have more than one pet peeve, but one of them is that people don't use PA systems right. I go to meetings where people say, oh, I'm a professional speaker. Can everybody hear me? I don't like using a microphone. And I want to go, really? No assistive listening system works unless the microphone is used. Number two, it's common courtesy. Number three, you don't know who's in the room, who's hard of hearing. Be sure to always repeat the questions or pass a microphone around so everyone can hear. Use the captioning. And learn, if you are the one holding the meetings via Zoom, learn how to activate captions in your business account. Now, regarding hearing loss program ideas, be in your community, be a resource for people with hearing loss. Talk about it. I have handouts for you that you might find helpful. For example, I've helped author this document. It was rewritten for the state of Washington, How to Buy Hearing Aids. It's a 4-page document that literally goes every step a person should go over when they buy hearing aids. If you deal with hospice clients, be aware that lots of providers in your community will treat people under hospice and even provide hearing aids at little or no cost during the time of hospice. And it can be a lifesaver for communication in those last few months. There's all kinds of videos on YouTube that you may want to share, and I'm happy to share some ideas. Offer educational programs, how to get the most from your hearing aids. Vet a local provider, invite a local professional, not to talk about, what's new in hearing aids, but have them really get into the nitty-gritty about dealing with hearing loss and what better communication strategies are all about. If you have local HLAA members, and you can find them on HLAA's website, start a hearing loss support group, be that resource person, do hearing screenings during Better May, that's Better Speech and Hearing Month, and consider developing a hearing help toolkit for your center that says, do you think you have hearing loss? You can add these little flyers in there so that you can be the one providing information. And here's my last slide. If you are attending because you live with hearing loss, there's all kinds of resources on the web. I highly recommend you explore some of the blogs by Sherry Eberts and Catherine Boughton and Gail Hannon. Gail is a comedian from Florida. Her book is filled with all kinds of anecdotes. There are some fantastic books about dealing with hearing loss. This is Dr. Myers, who funds my outreach. This is quite a technical book by an audiologist in Ireland. I like him a lot. This is all about rehab once you have hearing aids. And then there's a couple of podcasts available on the web, the Hearing Tracker, the Hearing Journal podcast, and Life Out Loud. And this website, Hearing Health and Technology Matters, is chock full of information. So it's not hard to find information. Once you start looking, you'll probably be overwhelmed. But this kind of concludes what I have prepared for today. I'm happy to open it up for questions. I know we're running short on time. Here are our emails, Penny's email and my email. By all means, contact.
Thank you so much. That was a lot of really great information. And Penny, thank you so much for sharing your personal story. I felt like it really hit on a lot of things that I've heard some of our clients say that they're struggling with hearing loss, the isolation and wanting to hide it and feeling less competent and all of those things. Thank you so much for sharing all of that. Most of the questions that came through, you ended up answering. There was a few more questions around the cost and how to get started. And if you had one of those questions, I'll be following up with a follow-up email to make sure you have access to Juliet, and you can ask those questions to her directly since we are running short on time. I'm going to stop the recording and I'm going to close out our meeting. Thank you again, both of you, so much for coming and doing this.
Thanks for inviting us.
Thank you.